Hi, everyone. In today's podcast, we're going to talk about the evidence on breathing techniques for pain relief during labor. Hi, everyone. Welcome back to the Evidence-Based Birth Podcast. We are getting close to the end of our pain management series, all about the effects of different comfort measures on pain during labor. Last week, we talked about relaxation techniques, and today we're going to talk about the effects of breathing techniques on pain during labor. Breathing techniques are part of the focus of something called psychoprophylaxis, which refers to teaching parents how to respond to contractions with relaxation and breathing exercises. Breathing during labor was first brought into focus by Lamaze, and Lamaze was originally known as the American Society for Psychoprophylaxis in Obstetrics. In the 1960s, Lamaze classes taught women how to use strict, controlled breathing patterns to cope with labor sensations. However, Lamaze actually stopped teaching these strict breathing patterns in the 1980s. There's a really great article on this topic by Judith Lothian that was published in 2011 called Lamaze Breathing: What Every Pregnant Woman Needs to Know. In this article, she talks about how as research expanded and we learned more about comfort measures during labor, that Lamaze shifted to encouraging women to use slow, controlled breathing, and breathing became just one of many non-drug comfort measures that they taught in classes. They now say that the right way to breathe is whatever way feels best. There's no rules, and breathing patterns should be individualized to the birthing person. Also, the key to using breathing techniques during labor is that breathing should be conscious, not automatic. So in other words, it's a behavioral or voluntary thing to focus on your breathing. Breathing, however, is usually not used by itself. It's typically combined with other relaxation methods such as guided imagery, visualization, hypnosis, continuous support from a doula, or progressive muscle relaxation. And one of the problems you'll find when we talk about the research is that because breathing is usually combined with a variety of other comfort measures, it's nearly impossible to tell the effects of breathing by itself on pain levels during labor. Now, how might breathing patterns work to help manage pain during labor or to promote comfort? Researchers think there are a couple different ways that breathing might work. It might work by interrupting the transmission of pain signals to your brain by giving you something positive to focus on or to distract you. Breathing could stimulate the release of endorphins, which are natural pain-relieving hormones. And breathing exercises could help you reframe your thinking about labor so that you view it as positive, productive, and manageable. The theory by which all of this would work is called the central nervous system control mechanism. Using breathing techniques and focusing your attention on your breath may activate mental processes in your brain that make labor sensations seem less unpleasant. Now, breathing techniques are a body-mind training mechanism that are used by people around the world for stress relief. There's actually been a lot of research, especially on something called abdominal breathing or diaphragmatic breathing. That's when, as you inhale or breathe in, your abdomen goes out, and then as you exhale, your abdomen goes back in. This is a slow, controlled type of breathing. Abdominal breathing is a core component of practices like yoga, Tai Chi, meditation, and I know many musicians who incorporate abdominal breathing into their daily lives. EEG studies on this type of abdominal breathing have found that even just a few minutes of using this type of breathing alters your brainwaves in a positive way, increases your relaxation response, which we talked about in the previous podcast, decreases your stress hormones, decreases your blood pressure, and increases your oxygen levels. So how many people use breathing techniques during labor? The Listening to Mothers 3 survey, published by de Klerk et al., looked at 2,400 mothers who gave birth in the United States in the years 2011 and 2012 in hospitals. They found that breathing techniques were the most common non-drug comfort measure, with about 48% of birthing people saying that they used breathing techniques during labor. However, an earlier study by those same researchers, published in 2006, asked mothers about the effectiveness of the different pain relief methods that they used. Out of all the methods that mothers said that they used, breathing was actually rated as the least helpful. So what's the evidence on using breathing techniques for pain relief during labor? Is it even effective? Well, there have been 4 recent randomized controlled trials that looked at breathing either by itself or as a package deal with other comfort measures, and researchers looked at the effects on pain or other outcomes. We were only able to find one recent study that looked at breathing techniques by themselves and compared them to not using breathing techniques. This study took place in Brazil and was published in 2017 by Boavia et al. They included 140 people who were giving birth. Participants were randomly assigned to either receive instruction in breathing techniques during labor or to not be encouraged to use breathing techniques. In this study, during the first stage of labor, the breathing group was instructed to inhale slowly, counting from 1 to 5, and then to breathe out gradually, counting down from 5 to 1. They were instructed not to inhale all the way full. When contractions were strong, the participants were instructed to take an extended inhalation and push their lips forward. This was called pursed lips breathing. And a physiotherapist demonstrated the breathing patterns to each woman. When they looked at pain, anxiety, fatigue, and maternal satisfaction, they did not find any differences between the people who received the breathing instruction and those who did not. Pain scores were high in both of the groups, an average of 8.8 on a scale of 0 to 10. All of these women were having unmedicated births and did not have access to pain medication. There were 3 other recent randomized controlled trials that we found where researchers combined breathing techniques with other comfort measures and then compared that to standard care. We've already talked at length in other podcast episodes about the Lamaze et al. 2016 study. We talked about that in our podcast about acupressure, childbirth education, and relaxation. This study took place in Australia and randomly assigned 176 low-risk first-time mothers to either a complete childbirth course or standard care, which included a typical childbirth course. The complete childbirth course took place over 2 full days and included 6 complementary and alternative medicine techniques that were breathing, acupressure, visualization, massage, yoga, and facilitated partner support. The complete childbirth course in this study introduced 4 breathing techniques to birthing people and their partners. Soft sleep breaths could be used for relaxation between contractions. Blissful belly breaths could be used during contractions for pain relief. Cleansing, calming breaths could be used in between contractions during the transition phase of labor. And then gentle birthing breaths were used during the second stage to encourage fetal descent and to help the mother avoid pushing. This was supposed to help protect the pelvic floor. The researchers found a significantly lower rate of epidural use in the participants who took the complete childbirth course. And when the people in the complete childbirth course group were asked about which specific techniques they used during labor, they found that the blissful belly breath technique was the #1 most frequently used comfort measure used by 60% of women in that study, and 35% said that they used gentle birthing breaths. So this study provides evidence that we've talked about before in our podcast that childbirth education that incorporates complementary medicine techniques, including breathing techniques, is an effective and viable way of avoiding interventions. And that's because there was a significant decrease in epidural use in that complete childbirth course group. Of course, because the breathing techniques were combined with a variety of other comfort measures, it's not possible to tell how much, if any, of the beneficial effects were related to the breathing techniques. There's 2 more randomized trials that we found. One was published in 2010 by Bahaduran et al. In this study, 117 mothers from Iran were randomly assigned to either a comprehensive childbirth class that took place over 8 weeks or to standard care. In this study, the childbirth education group received instruction in relaxation, massage, and breathing techniques. The paper doesn't specify which breathing techniques were taught. Instead of pain scores, these researchers measured vitality, which they defined as a person's reported sense of energy and life, and they said that it's the opposite of depression. The researchers did find a significant difference in the childbirth class's average vitality score compared to the standard care group score. They found an improvement in the vitality score immediately after taking the course and again after labor. Finally, one small study from Turkey published in 2004 by Yildirim et al. Randomly assigned 40 women to either usual care or to an intervention that included progressive muscle relaxation, breathing techniques, position changes, additional support from nurses, and massage. In this study, they encouraged slow, deep breathing in the early phase of labor and more rapid, shallow breathing during the active phase of labor. In the second stage of labor, during the pushing phase, participants were encouraged to use a pant-blow abdominal breathing technique. The researchers found that this multi-component relaxation intervention significantly lowered women's perceived pain intensity at 2 centimeters as well as at 4, 6, 8, and 10 centimeters. They also found that people who were assigned the combination relaxation intervention that included breathing reported greater satisfaction with their pain relief during birth. So in conclusion, we only have one recent study that looks at breathing techniques alone and compared it to usual care, and they did not find any benefits to just breathing techniques. However, we have 3 other recent studies where breathing was used as part of a more packaged deal, where parents were taught a variety of non-drug comfort measures and then they used breathing in combination with other methods. All 3 of those randomized trials found benefits from the combination of non-drug comfort measures that included breathing. Researchers think that non-drug pain relief approaches for labor work best in combination. Just simply using deep breathing by itself is probably not going to be effective unless you combine it with other methods, such as hypnosis, relaxation, guided imagery or visualization, or continuous support from a doula, or a variety of other comfort measures. Breathing techniques can be made widely accessible to pregnant people through childbirth education. If you haven't yet, I encourage you to listen to our podcast all about the effects of childbirth education on pain relief during labor. Many different childbirth classes include components of breathing instruction in their class curriculum. The techniques that are taught may vary, but most classes today that do include breathing techniques in their curriculum teach that breathing should be slow, deep, controlled, and conscious or voluntary, not automatic. So I hope you found this podcast helpful. Next week, we are going to do a wrap-up of all of the pain management topics. I'm going to give you kind of an overview of what I think we've learned from looking at the research as a whole on comfort measures for labor. And before we leave, I have 2 important announcements for you. The first is that next week, we are opening up applications for our evidence-based birth instructor program. We will be doing 4 different Q&A sessions that you can attend live to find out more about the instructor program, see if you're interested, see what the application process is like, and decide if you want to consider applying or not. Our first Q&A session is going to be Tuesday, August 14 at 9 p.m. Eastern Time. We will also have Q&A sessions on August 16, August 21, and August 26. So like I said, applications will open August 15 and they will close September 5th. If you think you might be interested in learning more about teaching evidence-based birth classes and workshops, just go to ebbirth.com/instructor to get on the wait list. And then finally, I'm really excited to tell you that I am moving forward with planning a big evidence-based birth conference in September of 2019. The location is still a secret, but I am getting really close to nailing down a location and a venue. The conference is going to be called the Evidence-Based Birth Conference, Bringing Evidence to Life. And based on feedback from my professional members, we're going to make the conference super focused on hands-on practice and discussion on different evidence-based techniques. So for example, we're going to have a learning track all about the different comfort measures. And I'm hoping to have speakers on topics like how to do sterile water injections for nurses and midwives, how to use acupressure for comfort in labor. We'll also have a learning track all about serving underserved populations and how can we help populations such as immigrants, African American women, teen parents, and LGBTQ persons get evidence-based care, because we know sometimes it's hard for these populations to be able to access evidence-based care. I also want to focus a lot of the conference on helping professionals learn how to facilitate normal physiologic birth, how to include trauma-informed care in their practice, how to help more people have VBACs. So these are the types of hot topics that I'm hoping to cover. I have a lot of dreams for this conference. I'm going to keep giving you little tidbits as I make more decisions. And I will let you know as soon as we have a wait list for registration. I'm thinking we'll actually probably open registration a year in advance, just because I know a lot of people who work in the birth world have to make their plans 9 to 12 months in advance. So anyways, I hope you're excited to hear the news. I will let you know as soon as I have more confirmed info. And we will also put out a call for speakers to lead workshops and breakout sessions. So keep your eyes open for that announcement as well. So that's it for this week. I look forward to talking with you next week, doing the wrap up of all of the different comfort measures and pain management strategies that we've talked about so far. Thanks, everyone. See you next week. Bye.